I'm joined now by parent Rick Mamie and recent graduate Kaylin Lloyd. So first of all, let's talk about these program changes. Kaylin, what are they? What are the big points for you?
The recent programming changes have really been devastating for students who are blind or visually impaired. One of the programs that have been removed are short-term programs, and those are intensive training opportunities that APSEA previously offered in Halifax. That is a learning environment that you cannot replicate in any other way. APSEA has also removed assessment services. APSEA previously provided psychoeducational assessments to students who are blind or visually impaired who needed them, recognizing that students who are blind or visually impaired learn and develop in unique ways, and a psychologist to make an appropriate assessment would require professional background in that area. But APSEA has eliminated that service and is pushing that onto the school boards and the private sector.
So they're going more virtual in terms of the learning as well, is that right?
Yes, what we've heard from APSEA is that their new service delivery model will rely more on itinerant services, which they have always had. Those are the teachers who work with students in schools. Itinerant teachers are phenomenal. Regional in-person gatherings, which are limited in the way that they can help students due to lacking in time, and many rural communities lack the infrastructure to teach some of the essential skills that students need. And virtual programs, which in the engagement we've done with families, they've told us virtual programming, especially for a skill like learning how to use kitchen equipment safely or cross a 4-lane intersection, is useless.
Mm-hmm. Now, in a letter to you back in March, they said while students who attended the programs valued the experience, it wasn't practical for many who were outside of Halifax, and they said the new model is more inclusive. What are your thoughts there?
We've heard the equity argument from APSEA for the last several years as we've been advocating against these changes. While it is true that some students needed to travel long distances to attend short-term programs and assessment services, APSEA did everything they could to remove those barriers, either paying a mileage rate or providing transportation, which would be a taxi, airfare, bus, whatever would work for that family. And students who couldn't attend were never left without services. APSEA had specialists that would travel to those students in their communities. What I say is more equitable is that students living in rural areas now no longer have access to the essential short-term programs to learn vital skills like mobility skills in an urban environment using a complex public transit system.
What would life have been like if you hadn't had that program?
If I hadn't had that opportunity, I wouldn't have been able to successfully move out of my home community of Bridgetown and take a full-time job in Halifax, which I did at the start of my grade 12 year while I finished high school. Short-term programs were the reason that I had the orientation and mobility and independent living skills to do that. There is no way that I could have developed advanced O&M skills in my home community of Bridgetown, where rush hour is when school gets out and there are 10 school buses leaving.
Now, Rick, you're a parent of a child who is visually impaired. What would you like to see happen? I know you guys have an event coming up tomorrow.
As a father, what I would like to see happen is a community be built. Since COVID, there's been a very large lack in community. There's been no real in-person processes. As a family, we'd love to support our son and give him everything he can do, but at the same time, I cannot teach him these lifelong skills that these short-term programs were providing. I don't have that same disability.
How many people are affected by this change, and how much money? I assume that's a part of it as well. Are we talking about?
So judging from APSEA's annual reports, there are 462 visually impaired people that they support in the Atlantic provinces, a total of 1,300 families in total with the deaf and hard of hearing community. And for money-wise, according to their expenditure budget in 2022, it was $500,000 roughly for maintenance of the building and the short-term program.
So Kaylin, what's your final message and what do you want to get out of tomorrow?
Well, families are really calling on APSEA to be responsive to the needs of students and bring back these vital programs that they've cut. Our town hall tomorrow with families is a closed space so that we can ascertain the exact impact that these program cuts have had on families. And we hope to use this town hall as a wake-up call for families and for APSEA and for government that our kids can't wait any longer. We can't afford to.
All right. Well, thank you very much for your time. We appreciate it.
Thank you so much.
Thank you.